One of the most important things that we have to consider when faced with someone with reflux disease that is not responding to simple dietary measures is what type of testing do we need to do to fully characterize that disease. On the surface, that seems like a fairly simple concept, but unfortunately, because we're dealing with the esophagus as well as the stomach and a number of sphincters that intervene in between, it's important that we fully characterize the motility and the contents of those organs so we can have a better idea of what's really causing the reflux and what are some of the outside influences, and also what complications has the reflux disease itself created that has affected other organs. When we look at those tests as a group, we divide them into motility tests and then tests of emptying, as well as pH testing. One of the ones that we would do would be typically an esophageal motility study, which gives us an idea of how does the upper esophageal sphincter work, how does the lower esophageal sphincter work, and how does the body of the esophagus contract. Has reflux caused an abnormality, or is there an abnormality that actually is contributing to the reflux? Another important study is going to be a pH study, and that's to help us confirm exactly how much and to what location the reflux is taking place. We know that there's alkaline type reflux, acid type reflux, which can be divided into both weakly acid and strongly acid types. And then there's also the refluxing of digestive enzymes called pepsin in particular, which is very important when we talk about laryngeal reflux or LPR. Other important tests, because the stomach is involved in this entire reflux picture, is we want to know, does the stomach empty normally? We need to make sure that the stomach is either emptying normally or abnormally. Either way, we'll be able to then judge how to better treat your reflux. And then the final test, which is very important, which is becoming more and more important these days, is something called the electrogastrogram. The electrogastrogram is something that will tell us, does the stomach contract normally, or is there perhaps an obstructive change that's contributing to the reflux that perhaps if we fix that first, might make the reflux better. That is typically the full family of tests. Of course, you would undergo an upper endoscopy or perhaps a direct laryngoscopy to look more directly at the tissues to see where is the damage. Do we have ulceration? Do we have inflammation? Are the vocal cords involved? These are some of the important questions that we'll be looking at when we do your diagnostic evaluations.